Good afternoon. I'm Sam. Welcome to week 4. Hope everyone's having a good week. Just wanted to upload a video this week for my response to the readings and the Reuters video. So I wanted to start with the video. I thought the video was really interesting because it captured the difficulty of sampling, developing sampling techniques for vulnerable populations. In this case, it was the homeless population in New York City. I thought it was interesting that they reported about 3,000, if not more, homeless people are in New York at any given time, typically in the subway terminals. Of course, this number is probably skewed and probably a lot lower than what the actual number is, but I think it provided a lot of insight as to why surveying how many homeless people are in a given municipality is a lot harder to answer than it may seem. I think this really speaks to Dr. Sell's paper on the random digital dialing technique when surveying folks and asking sensitive information such as sexual orientation or sexual identity. It's true, it's very difficult to identify because I think the sort of spectrum of the LGBTQ community is so diverse. It extends beyond ethnic and racial backgrounds, socioeconomic demographics, geographical location. And I think a lot of times when we try to identify folks that are a part of this population, we sort of make assumptions of who they are based on, their image, where they hang out, sort of the activism they may partake in, for example. So I think the sensitive nature of surveying and developing metrics to measure sexual orientation and gender are a lot more difficult than it may seem, just like, surveying a number of the homeless population. I thought it was interesting in the Cell paper that there was such a low number of folks who refused to answer the question pertaining to sexual orientation. That surprised me. I thought it would be a little bit higher than the 2.5%, 2.2% it was. So I think that just, provides insight as to, it's not so much that people don't want to report. I think it's how the question's being asked and what the metric is supposed to be measuring. So moving on to the Cell and Silenzio, chapter 3 of the book on LGBTQ public health work. I thought it was really important in the topic of sexual orientation that this figure 3.1 differentiated 3 constructs, which was sexual identity, sexual behavior, and sexual attraction. I think that was very impactful in my understanding on what sort of measures have a valid and reliable sort of foundation to them. For example, asking someone's sexual behavior is going to produce a lot different of an answer. It's going to relate to different implications of public health or health profession work than, let's say, a question about sexual attraction. I think it's interesting because, someone was to ask me, for example, again, I don't like to provide too much personal information, but again, it helps me understand. If someone asked me about my sexual attraction, I would report it in a means that might be different than if someone asked me what my actual sexual behavior is. So my sexual attractions and my sexual behavior, the answers that I would give to those questions on a survey or directly are going to produce different implications. And I think that's very important because, especially with sexual orientation, if you're trying to investigate, STI prevention interventions, or if you're trying to measure, um, violence rates, or try and promote violence prevention, I think it's important to distinguish what's the metric. What metric do you need that's not only going to be comfortable for people to answer, but is going to produce the correct, valid, and reliable metric for your study. So, in moving forward, I'm actually doing my master's project in the LGBTQ community, and I'm trying to narrow down my focus, but I'm interested in um, how care coordination is being taught and being practiced in various medical programs throughout Philadelphia. And all this sort of subject about metrics, sexual orientation, and gender as well, kind of gives light to sort of my project, because when I go to do key informant interviews and ask people why they might feel uncomfortable going to the doctor as a potential barrier to accessing care, I'm going to have to be careful and specific in what I'm asking. And I think, Dr. Sell, I got to speak with him this morning. Thank you, Dr. Sell. I think it's very important to narrow down and hone in on what is it you're looking for, where's the need, and of course relating it to any sort of literature review you might have already conducted. But I think it's really important because um, these questions aren't the same. Sexual identity, sexual behavior, sexual attraction, they're three very distinct um, concepts of sexual orientation in terms of surveying and getting sample data. And I think it's very important for all of us as health professionals to understand these differences and, really think about what's a valid, what's a reliable measure or metric that I need to use for my specific topic. And this kind of goes for anybody doing public health research. So I just wanted to provide some of my thoughts for the week. Again, my video is much longer than 1 to 2 minutes. Um, but I just wanted to, respond to the video and the difficulty of sampling a number of homeless people, all the way to phone sampling techniques, or just sort of developing those measures before you go out and do key informant interviews or collect primary data. So I appreciate the readings. They really help me personally with the development of my community-based master's project. But I think they also just kind of shed light on, where public health work on vulnerable populations, including the LGBTQ community, is headed, and where us as incoming professionals need to be culturally sensitive and also develop metrics that are measuring what we're actually trying to measure. So I think that's very important and very insightful to be taught in this class. So, excuse me. But thank you for the readings. Thanks for watching the video, and I look forward to reading everyone else's responses. Have a great week. Thanks.